We are here talking to Dawn about her experience in a COVID hotspot. Hi, Dawn.
Hi.
So Dawn's coming to us from Florida, originally from Jacksonville, right? All right.
That's where I am now.
Awesome. And you just came back from New Jersey, a hotspot of COVID. Thank you for being willing to share your experience with us and help us understand the reality of what's going on there, as many of us don't really know. So if you want to introduce yourself and then tell us what prompted you to take an assignment.
Well, I'm Dawn, as we just said. I've been a nurse for about 7 years now and a mother of a 2-year-old and a 4-year-old, married to my husband, Dan, who's awesome. And what prompted me to go? Really kind of goes back to early April. My hospital was sending out emails about PPE and not telling us that we were going to have to use no N95 and things like that. So I kind of went home to my husband that night and said, okay, what's our over under on our risk for our family? Because if I bring this home, I'm bringing it home to you and to the kids. And we talked about, kind of my responsibility to the general public as a nurse, as well as to my family, and continued on like that. And I actually got to the point where I had my own N95, and went in to swab a patient under investigation for COVID. And I came out of the room with only my N95 on. I didn't have a gown or any of the other mess because we didn't have any of that. And the nurse manager looked at me and said, you don't have to wear that, right? I said, I just came out of a patient, like I just swabbed her. That almost always makes someone cough. So it's mine. And that kind of makes me a little uncomfortable that you would say that. And she said, oh no, I'm not saying you can't. You can absolutely wear your own. So I went home that night and had a little bit more of a discussion with my husband, and then all of the elective procedures got shut down. So I am a per diem ICU nurse. So I only go to the ICUs and I go where they need me, whichever ICU it is that they need me. And with no elective procedures and everybody wanting to get the heck out of hospitals, I was canceled. Okay. And I was canceled again. And we had been canceling the babysitter for the days that I was supposed to be working, that he was supposed to be working. And we're like, I'm able to do something in this crisis right now. And we have the means to make this work. We have the babysitter. My husband works from home already. So we discussed the logistics of how it would work, how it would come home, kind of bartered back and forth on whether or not I was even allowed to wear jewelry to work, what he expected for me to wear for PPE, what I thought it was going to be. And then I started looking at recruiters and actually turned down a couple of contracts before the one that I had, because I also did not want to be gone for 2-3 months from my family.
Yeah.
And it all worked out quickly.
Yeah, it sounds like that was a really quick process. So one of the questions that came in was this your very first contract? And you've never been a traveler before?
I had never been a traveler before. It was my first contract, first time working with this particular recruiter, obviously then. And the process, I'm assuming, normally takes a little bit more than what it took me, which was about a week. The New Jersey license came in within an hour. I had to go get my physical, my titers, everything. I ended up getting that within a day. I'd already been fit tested for the N95, which was something that they were requiring of any traveler coming in. And yeah, once we got it going, we went full steam ahead.
Yeah, so something that a lot of people who want to do exactly what you just did, but their hospitals are saying you can have a leave of absence. We're not going to okay you to go. So if you leave, you will not have a guaranteed staff position when you come back. Did you run into any of that with your home unit or with your home hospital, I should say?
Not at all. And it's because of the type of contract that I had and the situation that we were in as a hospital. They had already canceled me for 2 weeks, and I spoke to my manager and said, "Hey, I was thinking of doing this. It's a 4-week contract." And then he's like, "Yeah, go." It's like, "Okay, well, can I have a recommendation?" He said, "Yeah, give him my number. It's fine." And I'm actually only missing, looking at the calendar, sorry, I'm only missing 2 days of work this month. And I was canceled pretty much all last month. And then I called in and say, "Hey, where do you want me to go today?" And then, "Oh no, we already took you off the schedule because you're traveling next week. Go.
Okay.
Don't worry about it." So it was good timing. And we didn't have a huge influx of patients for any reason while I was gone too. So I feel good about the whole situation. I was worried about that.
Yeah, for sure. For sure. Abandoning your own unit when they were needing you essentially to help somewhere else. And honestly, I feel like you're needed where you're needed. And if your heart was led there, then I think that's fine as long as you still have a job when you get back, which I think a lot of people are concerned about. So tell us a little bit about your contract, how it was structured, if you would recommend doing it any differently. What worked for you?
It was a crisis contract.
Okay.
And the biggest part of my contract that was crisis was the fact that it was only a 4-week long contract.
Okay.
That worked out perfectly for me, for my needs. And it seemed like for the hospital too. When I first started there, they had almost 700 COVID positive patients. And when I left, it was under 250. So
Wow.
they were starting to convert things back. Um, I, what was the original question? I'm so sorry.
No, you're fine. Essentially, like, how did you work your contract? And it was 4 weeks. Would you recommend doing it longer or shorter? Did you feel like that was a good amount of time?
It was perfect for me, and it seemed to work for the hospital as well. I probably won't travel again for a long time because I really miss my family, and the quarantining is hard to be away from my family when I'm not busy. I was only contracted for 36 hours a week with the understanding that I would get as much overtime as I could.
Mhm.
So I worked um, 2 days of orientation, then 4 days in a row, a day off, 3 days in a row, a day off, 3 days in a row, a day off. And then the second to last week I was there, I asked, I called in for overtime because they don't schedule you for it.
Mhm.
And they said, "Oh, no, we don't need you." And I was like, "Oh, okay. So how about we schedule me for Sunday, Monday, Tuesday of next week? And if you don't need me, I'll just leave on Wednesday." And that's what we ended up doing.
That's awesome that they worked with you. So someone just asked, so you're furloughed from your hospital. She answered that earlier. She's PRN at her hospital and they allowed her to go. So what was the teamwork like in New Jersey? Was there enough staff? Tell us a little bit about that.
So there wasn't enough staff, but that's why I went.
Right.
Um, I spoke to the director of the ICU before I went. I spoke with her during my interview, and then because the whole PPE situation, I had a little bit of trust issues. I actually called one of the units randomly and spoke to a random nurse and said, "Hey, how's the PPE situation there? What's going on?" And they told me. So I'm grateful to that nurse. uh, so they were short staffed, but the way that the hospital I was at worked it was there was a primary nurse in the ICU, and that was me because I have the the credentials and the experience. And then there was a secondary nurse who was a floor nurse or a surgical nurse, just someone without the ICU experience.
Okay.
And then sometimes there was randomly, I didn't see a rhyme or reason, but sometimes there was a donor and a doffer who would help with the making sure that we donned and doffed appropriately and took our face shields off. So some days I loved my primary nurse or my secondary nurse, and we worked great together. And I only had the nurse to myself, and other days I had to share the secondary nurse. And on those days, some days I completely monopolized their time because my patients were just overwhelming. And then a couple of other days, I maybe said hello to the secondary nurse. And that was about it because someone else needed the secondary nurse more than I did. And the teamwork was good, but everyone was so involved with what they were doing that it was sometimes hard to bang on the glass and be like, hey, someone, I need this extra thing.
Yeah.
But everyone was incredibly nice and very welcoming, and in general, very, very happy to have an extra set of hands and eyes there.
That's great. So did you experience any issues with your contracts, any issues at the facility that your agency company had to come in and help you with at all?
The only ongoing issue is that they have an online time card thing that they never gave me access to, and now they're asking me to put my hours in. That's really the only thing at all, and that's hopefully going to be resolved tomorrow.
Good, good. Another question just came in. How many patients were you assigned on average?
On average, 3. I started off with 4 patients one day, and then I ended up with 1 patient at the end of another day, one day. But on average, it was 3.
And those are vented ICU patients?
Oh, absolutely. Absolutely.
Okay. So let's talk about PPE. What were you wearing? Were you fully garbing with bunny suit, shoe covers, the whole 9 yards, negative pressure? What did all that look like?
So this hospital planned really well so far as converting the units. Most of the units. There was one unit that was not as pleasant to work in, but the other 4 units that I worked in had the little holes in the wall to have the IV tubing run through. All of the units were negative pressure themselves.
Wow.
And then 2 of the units had built-in negative pressure rooms.
Mm-hmm.
And then the other units had the big loud machines in the room with the HEPA filter, to suck the air out of the patient's room. So they were all negative pressure, and then negative pressure in the unit as well. The PPE, so I had, the hospital provided me with the disposable gowns for each time I went into the patient's room, gloves, 2 pairs of gloves each time I went into the patient's room, a shield that we were supposed to use for only one day and then throw away, but no one ever threw them away. So I wasn't going to be the only one to throw it away.
Okay.
Surgical mask over the N95 if we wanted. They told us that we didn't need the surgical mask if we had the shield, but I wanted it, and pretty much everyone said, whatever you want that makes you feel comfortable, you do. We did not use shoe covers. There's been a couple of studies that the shoe covers actually cause a lot of cross-contamination. So what they did was have a warm zone that was taped off outside the patient's room where you change into like a community shoe. So whoever goes in can wear those Crocs, which was very interesting because I didn't know this before I went there. So I had my regular sneakers that I was going to just wear, and then I'd purchased silicone covers to go over it so that I could just wipe down my shoes. Well, that did not work with trying to get in and out of shoes multiple times a day. So they gave me a pair of Crocs that were 2 sizes too small, and I waited for Amazon to deliver me Crocs that fit. So no shoe covers, but everything else, no bunny suits. I did put a family member in a bunny suit to say goodbye to their loved one, but we didn't wear the bunny suits on a daily basis. Oh, and then a hair cover, which there was one time that they didn't have hair covers, so we used shoe covers as head covers.
Okay.
And then I wore my own head cover underneath that, and I kind of used that. I wore that as a piece of my scrub, so I washed that every day. One of my friends was kind enough to sew multiple of those for me. And then they had hospital scrubs that we had to change into when we got on the unit before we went into a patient's room. And once you went into a patient's room, you were not allowed out of the unit until you changed back into your own scrubs.
Okay. Good deal. So it's kind of unclear whether the surgical masks should be used on non-aerosol producing procedures. What was New Jersey doing?
The hospital that I was at gave any person who went into a COVID positive or PUI room, patient under investigation room, an N95.
Okay.
I am under the impression that if we don't know, we should do what's most advantageous to everyone, and that would be to protect the healthcare workers.
Yeah.
And the N95 masks, because I know that's a big deal. It was a big deal for me too. They were recycling them 5 times when I first got there, and then changed it to 3 times by the time I left. And they were using the UV light to sanitize them. And you have a little tag on it that you put your name and your home unit, which ended up causing problems for me because I was going to different units not every day, but often I was changing units.
Yeah.
So I would have to go run and find my masks and then come back.
So make sure I'm understanding this right. When you say using it 3 times, you mean one entrance, you exit, you take it off, it's sanitized.
No. That's what I was told over the phone would
Okay.
happen. They had the setup with the paper bags
Yeah.
with the handles on it to
Mhm.
where you can take it off and put it there between patient rooms. I went by 3M and the CDC initial recommendations for 8 hours extended wear, which has had published studies that it's adequate.
Okay.
So I did not take off the mask until lunch, and then I changed it out for a new one or a previously sanitized one for the second half of the shift.
Okay. So along those lines, there's been lots of discussion talking about how that prolonged carbon dioxide is affecting you as a person. Did you feel lightheaded, dizzy, headaches, anything like that for you personally?
No, and I was prepared for it almost. I was like, okay, this is going to happen. I'm going to bring my ibuprofen. I'm going to bring my Tylenol because who knows if we're supposed to be using ibuprofen with this, and just in case I get it, right? I think that might actually be more from dehydration, from the negative pressure, honestly, because it was so drying. And particularly going to New Jersey from Florida, the humidity in general is much less. My face was very dry, my eyes were dry,
Mm-hmm.
my skin was really dry. So I think some of the issues might actually be coming from the negative pressure more than the carbon monoxide issue.
Monoxide. Yeah.
Dioxide.
Carbon dioxide. Yes.
Yes,
Anyway,
sorry.
okay. So when you doffed, another question comes then. When you doffed and you were changing back into your home scrubs, did you have a place to shower?
No,
Okay.
I did not.
And then, so you were able to let family members come in to say goodbye to their loved ones.
We were allowed to have one, the official rule was one family member prior to or immediately after withdrawing of care.
Okay.
And the family member was supposed to stay in the room for a maximum of 15 minutes.
Oh,
I'm not banging on the glass and telling someone they need to leave now.
no.
And none of my family members really overstayed either.
Okay.
20 minutes, half an hour maybe, but no one was wanting to stay in there for an hour or anything like that.
Yeah. Yeah, give them that respect. I totally feel you. Okay, so isolation precautions in terms of high flow patients versus intubated. Was your ICU taking those really high flow patients prior to intubation? And if so, what was that differentiation in terms of isolation precautions? Anything different?
From my understanding, the entire hospital, if you were COVID positive, you are on airborne isolation.
Okay. All right. Perfect. Any staff you work with get COVID?
Not that I'm aware of. There's going to be starting in 4 days, 5. 5 days. They're going to start antibody testing to any hospital employee who wants it. But of the people that I worked with, no one had an active infection or had a positive test. And from the questions that I saw earlier, they were not publishing that via email or any other method that I saw.
Okay. So, yeah, it's tricky because until we start sharing this information that these hospitals are obtaining on their staff, we don't know. And until everybody starts pouring that information into a public vat for us to sift through, it's all just kind of each to their own at this point. But it is what it is. It sounds like New Jersey was doing a really great job taking care of their employees. So we don't have any information on infection rate for staff dependent on different types of PPE, surgical mask versus PAPR versus N95s. To the best of my knowledge, that information is not available. Do you know something different?
I haven't seen any studies. I didn't see anyone doing any research in regard to that at the hospital. I do know that whenever we intubated or extubated or withdrew care, even with a trach, the people in the room had the N95 with the PAPR over that.
Oh,
So they were really concerned about things like that.
that's great protection, and not many facilities have that available. So, you were asked if you were participating in the antibody study.
I am not. I didn't know of a study that was being put out. I'm sure that there is, but I'm not taking part of it, and I am pretty sure it would be negative anyway. I'm hoping it would be negative.
Yeah. So, do you feel like the general public, do you feel like the media is hyping this up and causing unnecessary fears?
I think America is a lot like Europe in that we have a lot of states. Instead of having a country state like Europe has, we have a lot of different states. And each state, each city has its own reality that is COVID right now.
Right.
My current hospital has fewer than 10 cases, never had more than 50. So in my area where I live, it's not as prevalent.
Yeah.
In New Jersey, it absolutely is. I mean, they had almost 700 cases when I got there, and they were already starting to go on the decline of how many patients that they had.
Yeah.
So I don't think that's overhyped. I don't think that we know enough about the illness to dismiss it at this point either.
Yeah.
I'm more concerned about air travel coming back.
Yeah.
I'm glad that people are traveling again, but when they do, it's definitely going to spread throughout the community more, and hopefully no one else gets hit the way that New Jersey, New York, even some of the other hotspots were hit, because it's debilitating to the hospital, and
Yeah.
people die from non-COVID things because they can't be treated.
And that is very real. And I think a lot of people felt like maybe that is the media hyping it up, or but I know from other nurses that travel to hotspots, like that is very real, that is very prevalent in those areas.
For an ICU nurse to have a CRT and a patient and two patients that they're proning, it's not nursing, it's crisis management at that point. And I had another traveler take my assignment from me, and it was her first night, and she was like, I don't think that I'm comfortable with this assignment. I have to give blood. When was that even ordered? That was ordered 3 hours ago and you didn't. I was like, yeah, because he was getting a new trach. So he
Yeah.
didn't get the blood because breathing's more important, and his hemoglobin was 7.5. Like, it'll be okay. If you don't get the blood, the patient will be okay. You have to put out the fires and then go be a nurse afterwards if you have time.
Yeah. That sounds like a really different part of nursing, and not many of us can say that we've been there. I mean, of course you have that shift where you're just putting out fires and doing the best you can, don't get me wrong, but not 4 weeks of it, not 3 shifts on, 1 shift off, or 3 shifts on, 1 shift off. That's not our normal. So you were in a different mode of nursing.
And I knew when the end was. The nurses who were there, and that's their home hospital, they had been doing this for 2 months already and didn't know really when the end was going to be. I asked them, I was like, do you see that it's getting better? Like, they closed down this unit and they closed down that unit, and you can see the numbers decreasing. You're like, yeah, we'll see. We'll see.
Yeah,
just going to keep plugging away.
Yeah. You don't want to get too hopeful, because then you let down your guard. You just get to keep plugging away at what's at hand. So a question came in about the general public and whether they should be wearing masks despite their lack of knowledge on proper use and protection. What's your take?
The masks are good, in my opinion. I think even worn improperly, they're better than nothing.
I agree.
And there's so much asymptomatic spread, and it's getting over the ego too of saying, oh, well, I don't want to do that, I'm not afraid. It's not about you. It's about you transferring it to other people. It's about you becoming an asymptomatic carrier and then spreading it to whomever it is that you come in contact with.
I agree. Is it perfect? No, I don't think it's perfect. But the person that's wearing it below their nose, well, if they cough, maybe it's going to contain some of the germs that are flying through the air, right? Of course, if they're wearing it on their chin, well, then you may as well take it off. But,
right.
The gloves are a huge issue. I wish they would just ban public glove wearing.
The gloves bother me.
Unless you have a box of gloves in your cart and you're donning and doffing as we should, then don't wear the gloves.
Or dip them in oil first. Dip the gloves in oil first so you can see what it is that you're touching, and then go on with your, or like a black oil or tar or something. Because I think
and put it on a video so that people could see that she used purple paint, and she could see how it was just getting everywhere. And it was a great thing to share with the elderly family that I know is wearing gloves. Anyways, we digress. So I also agree that public mask wearing is not a bad idea. And just because you don't like it, or just because you don't think it's convenient, doesn't mean that you shouldn't do it out of respect for the granny who's still working and supporting her grown children who live with her. Just do what's right so that granny doesn't get COVID if you're a silent carrier. Anyway, moving on. How many got treated as COVID-19 even though they showed up negative test results? What other ways, CT, labs, symptoms, etc., did the doctors come up with the diagnosis, or was it just presumed COVID-19?
So I'm going to answer that from my home hospital as well as the hospital that I traveled to.
Great.
Before I left, all of the nursing homes were requiring the physicians to certify that patients going to long-term care or nursing homes that the patients were certified negative.
Okay.
Well, the test results were taking at that point up to 10 days to come back. And it's just not financially responsible to keep a patient in a hospital waiting 10 days for a test result. And what I had one physician do was look at a CT of the patient to show that there was no inflammation. That's what happened. After working with patients with COVID and after doing more research, I really don't agree with that, because you can have COVID and not have pneumonia. You can have COVID and not have any respiratory issues whatsoever. Mm-hmm. So there's no good radiographic tool to say, oh no, you don't have this disease.
Okay.
And in New Jersey, the hospital that I was at did not presume any patient to be positive while I was there. They got the test. They were on precautions until the test came back negative or positive. As soon as it came back negative, they were shipped off to another floor where they didn't have to spend all the PPE on the patient.
Mm-hmm.
And if it was positive, they stayed there. And there was actually a unit where elective procedures had started back up before I left. So any patient coming in for an elective procedure, they had an entire wing of the unit that was for rule out patients. So these were all patients who were coming in to have a procedure done that was elective, like open heart surgery or something like that, that could have waited a little bit longer, but now they kind of really need to have it done. Before this, I never would have ever dreamed open heart surgery could be considered elective, but
Right.
apparently, in some cases, it can. So no one was held in an ICU or a COVID unit other than the rule out unit. And then as soon as they were negative, they were transferred off of that floor.
Okay, so a couple of things then. The test was originally taking up to 10 days to come back. What are we at now in New Jersey? What's the turnaround?
I don't actually know what the turnaround is. I wasn't on the rule out floor, so I didn't get to look in those charts or really discuss that too much with anyone.
I know that they've made it faster. Any of you that are watching, let me know what your current turnaround time is at your facility. And then secondly, a lot
At
of
mine here, sorry, at mine here, it's about 4 hours.
oh, that's
We
amazing.
have we have a rapid result now that I actually took today and was negative, so we're just waiting on one more negative before I get to go home. Yay! But at my facility, it's currently 4 hours, and I asked, and they are using that on the patients as well.
So you've got a rapid COVID. Have they lineated rapid versus the test that takes longer? Is one more accurate than the other?
I haven't seen any studies on it yet, and that's why my husband and I agreed on 2 negatives or 2 weeks, whichever was shorter. I'm
Okay.
hoping on the other result to come back
Okay,
this
so
week.
we've got some comments coming in 2 hours, 45 minutes to an hour. That's amazing, right? We went from 10 days to hours. Like, my gosh, that's so cool. Another public presumption, or maybe media fed presumption, I'm not quite sure. We'll just address it real quick. That patients are being labeled as death by COVID for things that weren't really COVID related. Did you witness any of that?
No, not one. We did have a patient come in with a car accident that was a patient under investigation,
Yeah.
because we didn't know, uh, and he was on a rule out unit, so I didn't get to follow him to see what happened.
Okay.
And I hope that that patient survived as well.
Yeah, absolutely. So we're going to move into more of a discussion about your decision to leave your home hospital. And you talked a little bit about the fact that you weren't really needed at the time. And so thus you were like, I can help here. But did you feel like you leaving your home PRN position as an ICU nurse, did you feel like the risk was greater for you going into this hotspot area versus where you were at?
I I'm going to put it this way. When I was pregnant, I asked for all of the contact patients except for shingles because of the risk to me and the baby at that point. Because I knew what I was going into. I knew I had to don everything. I knew what would protect me. Whereas when you go into a patient's room who has nothing, and then 2 days later, oh, they have C. diff and also pneumonia from the flu. So glad that you were not protected at all for 2 or 3 days there. So I think I was much better protected traveling, and I knew that I wouldn't be bringing it home to my family as well, which was one of the major contributing factors to me going.
Yeah, super smart. And did you feel like it was worth it to go and put yourself in that place? And worth it is a really subjective term, right? Like, your definition of worth it and my definition of worth it are probably going to be very different. You felt safe in New Jersey. Would you do it over again? You said you wouldn't take another contract, but if you were to go back in time, and would you make that same decision?
I think I would. In fact, I think I might try to do it a week earlier because
Okay.
I feel like by the time I left, they still needed help, but they didn't really need me as much. But it was good timing. the hospital that I went to had already figured out a lot of the kinks. It was very safe for me. And again, safer for my family almost because I knew that I wouldn't be bringing anything home to them. It was really hard to be away from them, but it's safer.
Yeah, absolutely. So, do you have any advice for nurses who haven't experienced the hotspot element yet? And maybe they're going to get there. And maybe experienced nurses, or maybe some advice also for those new grads who are being baptized by pandemic. Anything specific that you'd like to say to them or mention to them in terms of advice?
For new grads, I always say that the first year is horrible and it gets better because you don't know what you don't know when you're a new grad. There's so much that you don't know, and you don't even know that you don't know these things.
Right.
And right now, it's particularly bad or difficult for you because your fellow nurses don't have time to help you learn these things. So keep going, continue to study. And by study, I mean look at research articles, not news, and make sure that it's peer reviewed stuff that you're really looking at and not Wikipedia or randomness, and ask questions of the doctors and the nurses when there's downtime. So that's for the new grads. For people who haven't experienced it yet, and you think it's coming, stand up for yourself for the PPE. Get what you can for your PPE. I ended up in Florida getting my own N95. I know it's difficult now, but if your hospital doesn't have KN95s, those are readily available now. So purchase some of those for yourself and just make sure that you're taking care of yourself in all ways. I was very good with the self-care in New Jersey. I was making sure that I was drinking my water. I was trying to make sure that I was eating well. I made sure that on my days off, I went out and got sunlight whenever there was sunlight because it rained all the time while I was there. But I made sure to take care of myself. And that's easy to do when you're on a travel assignment because it's different. You're not home and you can do something different. Try to do that even if you're at your home hospital too.
That's great advice. So, how would you say you are doing personally?
I really miss my kids and my
Mhm.
husband. They were kind enough to lend me the dog, so I'm glad to have her.
Mhm.
I gave a hug to a family member who had come to say goodbye to their loved one on one of the last days, and I probably needed the hug as much as she did at that point. The lack of human contact is hard, particularly for such a hands-on profession. We're used to touching people and not always through two layers of gloves and a mask and a shield and a noisy thing in the room pushing
Right.
out all the air. But I'm doing okay, doing well. One of the things helping is school started last Wednesday. So I'm trying to dive into coursework. It's my second career, and I'm going back to get my BSN.
Good for you, girl. How did you feel like other staff that you are working with, those ones that are in the throes of it and have been in the throes of it for months now, how are they holding up?
I could definitely see some moral distress in some of the nurses.
Yeah.
Some, I like to call it being a duck, where you're kind of looking pretty stable, pretty good, but underneath there's a whole lot of paddling going on. I could see that with some of the nurses too, where they, yeah, I'm good, I'm fine, this is great. It's yeah,
Yeah.
and it wasn't. And a lot of people were thrown into roles that they've never been in before too.
So, what did you feel like was expected of that team physically, mentally? I mean, you were working 3 on, 1 off, 4 on, 1 off. I mean, that's physically demanding. Is that what everyone was doing?
No, no. The most of the staff at that point, I think, had already done that, and that
Okay.
was part of the reason they were bringing in travelers and bringing in PRN nurses from other facilities. Most of the people were working 3 to 5 shifts during a week, during the pay week. And then when I left, they had started canceling all overtime. So I think that will end up helping a lot of the nurses in their self-care and taking time away from work, because when all you're doing is living COVID,
Right.
it's hard to take care of yourself.
Right. Did you feel like there was any outreach of support or any other, I don't know, were they doing anything different in terms of supporting their staff? Did you see any extra chaplain services or anything going on?
The spiritual care office had its door open, but I didn't see a chaplain there the whole time that I was there. It's not saying that they weren't there, but I
Right.
didn't see anyone. I know that the hospital itself was giving pandemic pay to everyone who was working,
Mhm.
and the community was really supporting the hospital. It was amazing. It was starting to taper off by the time I left. Everyone was getting tired of the pandemic,
Yeah,
but the community was sending in food all the time. There were lots of homemade masks, some of them not very appropriate. I think one of them was made out of like curtains. It was very, very thick, heavy material with a um, coffee filter put in there. People had donated the ear savers, and it was amazing to see the community support. And while I
yeah,
was there, they did one of the things where people, the little parades where people go by honking and things. I was stuck in the unit, but I heard about it. And on Mother's Day, someone brought in roses for all of the moms. It was really sweet to see the community supporting the hospital.
that's awesome. Do you know if there's any continued plan to follow up with these travelers and these nurses who have been in these hotspots? By who? I don't know who would follow up with these people, but do you know if there's any plans to follow up with these staff who are bound to have some residual effects of all of this?
I haven't been contacted by anyone. I think it would be a great research study for like a qualitative type research study to
Right.
see how it impacted the different staff members that traveled in and the staff members who were still there.
Right, for sure. So nursing students, if you're watching, that's an amazing project that you could head up. Go survey a bunch of nurses or doctors or any healthcare staff really that were in these hotspots, and what does that look like and how can we do better to watch out for us in the future. So now that you're back in Florida, what steps are being made to get you back to your home and to your home job?
So before I left, part of the thing my husband and I did was come up with a plan for me to get back home. And as I said, it was 2 weeks isolation or two negative tests, whichever came first.
Yeah.
So I have a friend who has an empty house because of some situation going on with his family, and they've graciously allowed me to stay there. So I'm staying there, and I took a test for COVID that was being offered to anyone who lives in the county that I live in last Friday, and then today I took a test at the hospital that was rapid resulted. So I'm just waiting on that community test to come back, and then I'm gonna go home. We've discussed me wearing a mask and the kids wearing a mask when I'm close to them until we actually reach the 2 week mark, but actually letting me come back home and be a part of the family in person again.
Absolutely. I'm so thankful that you guys ironed out these details before you left, because what an emotional toll this has been with you being gone and what a different dynamic it is. But if you have these benchmarks, and all of us can set these goals for ourselves and set these benchmarks of what's safe for you. And, right now, if you hadn't had made those,
Oh,
maybe
I'd be home.
right, right. So if you just set some benchmarks in place so that in the back of your mind, you have this goal and that you're going to reach this goal for the safety of your kids and your family. I think that's so smart that you guys did it that way. So what would you say your biggest personal and professional development takeaway was from this entire experience?
Personal is maybe that I'm a little bit stronger than I thought I was. I can stand to be away from my kids for more than 4 minutes at a time. Uh, and professional is just to keep learning from anyone that I can, which leads me actually to something for the new grads too. Always know why you're doing something.
Yes.
Always know why you're doing something. I was doing UAs or urine analysis on every single patient who was on remdesivir. And I asked the doctor, it was my second or third day there. I said, why am I doing this? He said, I don't know. You're going to have to ask the clinical pharmacist. And this was a cardiothoracic surgeon who just got thrust into the role of COVID ICU. So
Sure.
he was doing what he could with what he could.
Yeah.
And was just like, yeah, we need to get the UA every day on these patients. So I ended up calling the clinical pharmacist, and it's for a toxic accumulation that could actually damage the kidneys and cause some serious issues for the patient.
Mm-hmm.
But I didn't even know what I was looking for when I was looking at the results. And another time, I had a patient who was a young guy, actually, who was on his like 16th day of proning, which involves, for those of you who don't know, that involves paralyzing and sedating the patient, which had its own issues with not having enough equipment as well. But I was sitting there, I was like, okay, I've never proned a patient before. This seems like a really long time to be proning this guy, and his ABG is still looking horrible. He's not doing any better, even though the tidal volume was 320 with 32 breaths a minute and 100% oxygen and nitrous and like everything that we could do, we were doing for this guy.
Yeah.
So I had actually downgraded one of my patients and sent off the floor. And I had a minute. This was the day that I ended up with the one patient. I had a minute and was looking through peer-reviewed journals to see what this proning thing is and why and how long to do it and all of these things. And later that shift, I saw the attending looking at one of the same articles that I was looking at. And it opened up the door and said, oh, is that this article? I was just reading that a couple of minutes ago.
Yeah.
And he said, oh, yeah. And it opened up a very good, frank conversation with the doctor because he had some of the same concerns I did, which also made me feel really good about the questions that I was asking.
Awesome. So did you guys end up putting him supine?
Oh, yes. So we were doing a 16-hour prone, 8-hour supine
Okay.
schedule for him. It was just how many days to do it for and the benefit versus the risk. Because when you turn a patient, there's risk of separating from the ventilator, so many things that can go wrong when you turn a patient, particularly by hand, like we were. We didn't have the roto beds that I was prepared to use. I looked up how to use them and everything, didn't need to do that. So we ended up continuing on the same course of treatment, but it was good to know that I wasn't the only one with those questions and that it wasn't a completely uneducated question that I had.
Sure. And for those of you who are listening who've never proned a patient, it's quite an art. And once you get it mastered, it's really amazing. But it's something that's vital. If you have an ICU patient that's not doing well, suggest proning. It's so, so helpful. And do it sooner rather than later. If you're already paralyzed and on a vent and you're not seeing results, like prone them. You'll see results. It really is phenomenal. It's amazing.
And
So,
they had a prone team there that was amazing.
yeah.
So the first time that we proned someone, I was just able to kind of, I mean, not watch, I was part of the team, but they directed me. And then the next time I did it was even smoother because I had an understanding of how we were doing that.
That's so great. I love that they had a prone team. That's amazing. I love that you were looking at evidence-based research while you had that moment because, man, like you're saying earlier, know why you're doing what you're doing. And that's so true. Like if you don't know, a lot of times you probably didn't have an opportunity to look it up. But man, when you do have that opportunity, like soak it up, get that information. You've got, let's see. Oh, you've got some sweet comments coming in. A new grad said, noted, thanks. And someone else, Tina, what a smart nurse. Thanks. I love it. My sister had to do 12 hours on her stomach. She hated it. So I don't know if your sister was a COVID patient or not, but it sounds like she's doing better now. Thankful for that.
And we did have some patients self-proning as well, which was something I had also never seen.
So your COVID positive patients, you were having them self-prone proactively, it sounds like.
On the floor. This was obviously before they got to the ICU, but on the floor they were self-proning, or proning themselves.
Right. Smart. That's awesome. Well, if we don't have any other questions coming in, I want to say thank you so much for taking that time, going to New Jersey and being part of that team. I can't thank any of you who are out there in those hotspots and working with COVID patients. Thank you, thank you, thank you. And we will close with your favorite nursing hack.
My favorite nursing hack. Oh goodness, I don't know that I have one.
Oh, come on. You do tons of things to make your day easier. What's one of them that you can share with a nurse that maybe never thought of that?
I'm an ICU nurse, so I always make sure that my lines are untangled at the beginning of the shift. So I
Yeah.
know where I'm pushing what. If I need to push something, I know where I can do that. And I set up myself at the beginning of the day as to when meds are due and when I intend on doing time intensive things like proning or bed bath or oral care. If, in New Jersey, if I had the time to actually really put lotion on the patient and do nice things. So I set myself up at the beginning of the day and I try to get everything done as soon as I can because there's always going to be something later in the shift.
Those are great tips. I absolutely love it. Those of you who tuned in, thank you. Oh, she said that her sister was COVID positive that proned. Well, I'm thankful that you've tuned in and shared with us. And I'm glad that she's doing better. I appreciate you guys, every single one of you. Hats off to you. I appreciate you. Dawn, thank you for tuning in with us. It
My
was
pleasure.
wonderful. Have a great
Thank you.
day.